of our last track for the day, that is track 5. To chair this track, may I call upon Dr. Jyoti Clara, founder and former National Vice President ANEI, onto the stage. We welcome you, ma'am. May I also request the eminent speakers to come onto the stage. Mr. Samir Mehta, Vice Chairman, Dr. Mehta's Hospital, Chennai, and Vice President Kaho. Dr. Jagdish Kumar V, Senior Consultant and Physician, KIMS Hospitals, Hyderabad. Colonel M. Rajgopal, retired and founder, Transland.org.
A round of applause for them, please. Let me take this opportunity to introduce yet another iconic, powerful personality among us, none other than Dr. Jyoti Clara Michael, Director of Nursing, IHH Healthcare India, Gleneagles Global Hospitals. Madam is the chairperson for ANEI Research Committee and Tamil Nadu State Official Member, Kaho, AHPI, INS, and member of Technical Committee of NABH. CII Healthcare Excellence Assessor. Also, she is an expert committee member from NABH, NABET. She has many awards, accolades, research, and publications added to her credits. To mention few, Deanship Training, University of Wisconsin, USA, 2008, and the ETA Pi Research Award, International Travel Award from MNRS USA, Prime Leaders of Leader Award by Einstein World Record in 2023. She is a Principal Assessor of NABH and Nursing Excellence and Faculty of POI. May I request Dr. Jyoti to kindly lead the track.
Thank you for those kind words. Good afternoon to one and all. I think you enjoyed the previous session. I was taken away because I was less competent than those who spoke, the students who came up and spoke when I was growing as a student. So hats off to all the three candidates who came up. This shows that nursing has got a bright future. From there on, what is that we are going to discuss in the next track is about cooperative learning. Always when it comes to nursing, what do? We have a focus. It's the nursing department. We do it vertically. We manage everything by ourselves, and there is very least amount of cooperation. So probably it's because the most efficiently discipline-wise functioning department is nursing. This is what HR says always in any organization. So many times we don't think of collaborating, co-creating, and work with the other sectors or the verticals. I'm very happy today that we have got three gentlemen here, and it is actually unusual. There are no women on the dais except me here, and this is not a usual pattern in nursing. You all would agree to me, but I'm very humbled because these three gentlemen are having something in common and very special in common. First, passionate professionals. One is an entrepreneur, the other one is from army background, and the other person is from the medical fraternity. All three of them carry something common. There is something common when you ask somebody, do you predominantly focus on your heart or your head or your bones? Then people say, and I say, I do give more importance to heart, although I don't neglect bones and head. And I was taken away when all my panelists did so. So I think we all can do a good job together the next 40 minutes. So the speaker for today's first is Mr. Samir Mehta. He needs least introduction. I think he would have met everybody and said hi from morning, from yesterday evening, and most of you know him. And I knew him few years ago, I think maybe 15, 20 years ago, when I was speaking in one of the conference in Kaho and I came down, I was new to India that time after my international placement. He came from the car, he came down, he came to me and he introduced himself. And that was the humble nature of yours, Sam. And from then I thought I should have a mentor like him from another industry where I can learn. And that is how Sam is a very good leader and a mentor that I could always consider and a good friend. Now, to add to his gamification officer, it is very surprising that he has finished his PhD, almost finishing his PhD from IIT Madras. And he has done a lot of work on behavioral sciences and he has brought in gamification in leadership. And with the witness of enjoying 2 sessions of his, I'm sitting here to enjoy his presentation today. And there are so many accolades added to him. He is on the board, he is a chairman and he is a president in many organizations. And Sam, the most interesting one is your hobbies, like designing games, reading, collecting arts and football and dancing. We are yet to see your dance this evening. Over to you.
Good people make me dance. We will trigger the presentation. When I wanted it, it wasn't there. Okay, now I leave it be. Good.
To have a change from morning, we thought there will be a 7 to 8 minutes presentation and then the rest of the 50% of their time will be given to the audience. So you have all the right to connect and then ask questions, maybe share your ideas, and probably at the end you will be put a question where you have to give some ideas for us to take as a resolution for this conference.
So I'll try to stay near the mic so that you can all hear me. Have some fun today. So I think if you can port it over, quickly jump through, backgrounds irrelevant. I'm going to tell you a little bit of glimpse into the future, and the reason is simple. The world is changing, it's changing fast. For those of you who don't, you see the news. 10 years ago, did you spend all this time looking at WhatsApp? No. Today, your kids spend more time on WhatsApp than with you. Your parents spend more time on WhatsApp than with you. True? You probably spend more time on WhatsApp than your spouses. Meaning with your spouses. They're probably also having an affair with WhatsApp only. In some ways, it's good. Look, so the challenge is today, and you really don't need too much help figuring it out. We've got things like consumer demands are going up. People want convenience, comfort everywhere, transparency. Dr. Google has become the #1 health trusted advisor where there's no trust really, because there's no accountability with Dr. Google. And ChatGPT will make up an answer and fill in the gaps. Let's be honest, not that Google will be any better or anybody else. And you've got all the way from, this is probably the last set of years where the war for talent has more jobs than qualified professionals. Trust me, as we go forward, there'll be more people than jobs. Guys, trust me, this is not a small thing. If you have a doubt about it, look at truck drivers in the US that are changing their skills so that they may have a job after 5 years when automated trucks are in service. Today, a lot of ships are automated. You don't know that. You don't notice it. You used to have multiple navigators in the captain's office. You don't have that many now. A lot of the ships only have one person to check and to stop. Right? So the world is changing dramatically. There are a couple of trends. I mean, clearly, I think folks like Tangam have been deep in areas like home care. I think we have many other leaders in home care. We helped create it, but you'll get a lot more care plus industries. We're seeing senior living. We're seeing clearly privacy and value-oriented healthcare growing. Today, a customer is shopping across multiple platforms to figure it out. And healthcare is going to be broader. We talk mostly about physical health. It's going to also be mental and emotional health growing in more. The rest is all obvious. Co-pay, for those of you who all think insurance and the government solves all problems, it's not. A person has to own their healthcare. So if they pay for it partially, they will be forced to own their healthcare again, which is what they used to do in the old days. And you're going to have the rise of robots and machines. But this is the ultimate chart that tells you how life is going to change. These are diseases in slices of time. From 1900, there are only 4 diseases that are still there today. By the way, I look at this slice again in 2040, only 4 will still be there of this top 10. Right? You look at some of the other ones, COVID-19 didn't even make the list on 2021. Please note that we were so scared the world stopped for a disease that wasn't in the top 10. So sometimes noise is more significant than data and content. So what does the world look like in 2050? Right? You're going to have interconnected everything. From your home, from your work, from the fact that you go on a holiday, you piss in a conference here and it will give you your healthcare update. Why? Because it's probably synced to your phone or some other device, probably in your shoes. It's going to have a personalized assistant for everything. We'll have a lawyer assistant on chat GPT 24/7. Maybe some people will have their spouse on 24/7. My spouse is not available 24/7, she's clearly told me. But we'll also have workshop-based humans. You'll have biohack humans. If you haven't seen this, you should go and see the biohack workshops in the US. There is, I'm told, about 13,000 humans with more than 9 new parts in their body, including phones. Think about it. A phone changes every 3 months, 6 months. Your kids replace it every year. What the hell is a person putting a phone in their damn hand for, or their earlobe for? Makes no sense to me, but this is happening. The fact that 13,000, it's a fraction, but the problem is these are the early movers. You'll have standards for everything. The good news is we'll be in space, so some of us will be able to put some distance between us. If you don't like a doctor, send them out, or you go out, choice. And we'll have teams with systems and robots. I think this is the reality of what it looks like, but more importantly, it will range all the way from the simple stuff of nice teachers. It won't be a doctor, but the diagnostician and the person who's probably by the bedside with information is probably a robot. All the way to in space, the robot will do more work than human. Why? Because it's just easier for a robot. And perhaps we'll also have companionship that's more available 24/7 because everyone's having an affair with WhatsApp. Right? Some of you are having an affair with work, but that's because you guys are serious. So what for the hospitals? I think it will be frictionless. I think we will live well beyond 100. So you will start having people complaining about simple, complex and more complex things. But more importantly, the things we don't take ownership early in life. Everyone who's got diabetes understands this. If you overindulge yourself like a Gujarati does, you probably are going to suffer much more. If you didn't understand your genetic predisposition, it will be much worse. And borders will not matter. It will not matter if you're a nurse in Madras versus a nurse in Fiji. Why? Because you will end up having one nursing council that has global standards. If you haven't figured this out, that was the primary purpose of the UN and WHO. They haven't achieved anywhere near it, but it will be forced because global markets will be connected by workforce. It will take time. I'm not saying this is going to happen tomorrow, but guys, I've got till 2050 to get it right. I will still be around. Hopefully invite me to ANEICON then. I will come. Tangam, you will still be around if you come to Dr. Mehta's or at least any of these good hospitals around here. But I think really I want to leave you with this slide. I don't want to bore you. You will have many more leadership roles. So guys, kill yourself fast. Forget the salary. You will own the right to set salary. Get this right. You can either be asking for better salaries or own the right to set the salary. Right? So that's all you have to do. More of you sit in leadership positions, you should be telling everybody else on the table, these people are the most important, therefore we're going to promote them. It's as simple as that. And you'll have things like not only the patient safety care leaders, but you'll also have things like extended care coordinators, which the natural owner for these roles is not a doctor. It is not an admin person. It should be a nurse. So guys, the more you skill these, you are the only profession, when they looked at the world's top professions, that is guaranteed a job till 2050. The only profession, even doctors are at risk. So get this right. So I'm going to close with that so that you guys have some time to give some spicy questions. And I think have fun. More importantly, I think just upskill yourself. And if you're faster than all your peers on tech, and I don't mean your nurse peers, if you train all your people on just tech with nursing, with some of the others, you will be ahead of 95% of the rest of industry. Because the rest of England and US, and they're not even thinking about this. They're looking at their tech, which is all archaic systems that are locked in by insurance. That is the advantage of Jugaad in India. Solve that. You will not regret this advice. This I will tell you. Right? We think it's the AV person, but actually a nurse who has it on the fingertips in every ward will be the doctor's best friend and the indispensable one, so that the doctor becomes redundant because the machine is there now. Thank you.
Thank you, Sam. So let us not wait for the opportunity and then develop us. We have to be prepared. So the opportunity will not only knock at the door, but we will be invited to an organization with a red carpet. So we cannot hide a candle when it is lit, and you need not mount it on the mountaintop. It will always be shown to everyone if we are talented. That is what Sam told. And also what he told is, like, all these are possible only when we start integrating cooperative learning, which is very important. He has not specified into various cooperative learning in that. We have only put in concepts to you. So think of intelligent question or bring in some ideas for further discussion. Thank you, Sam. Over to the second important speaker. He is from a medical fraternity, and he is none other than Dr. Jagdish, a consultant and internal medicine. When I saw him first, I thought most of the internal medicine, see, as per the specialization, the nature and the characteristics goes along with that. A cardiothoracic surgeon, when you say you can really name 1, 2, 3, 4 are his nature, and he is perfectly internal medicine physician that I could see, because he said he is more into involving nurses into decision making. So he has cooperative learning methodology in his department. He also understands what are some of the areas nurses go beyond nursing, which will help them to become more stronger in the area. So Dr. Jagdish comes in with 10 years of physician experience, and he is working currently with KIMS Institute, and he has got several publications to add to his credit, which you can see on the screen, and he has got several publications and research papers. So over to Dr. Jagdish.
Good afternoon, everyone.
Good afternoon.
Thank you, madam. First of all, thanks for inviting me to this podium. I feel lost of nostalgia because a year back I was just here. I was one of the faculty in AIG. Anyways, first of all, I need to congratulate for two things. Number one, I congratulate all the people who have come join this evening, because you have chosen the right conference. At the same time, one more congratulations, because all of you people have chosen to be in healthcare sector. Yes, I mean it. So what is about healthcare sector? So what is happening? What is the change we have seen in last a decade, last 20 years, last 30 years? Probably, again, I have to agree with madam, because I don't know by what choice they have made three of us on the panelists. Whatever Mr. Samir has spoken, I think all my slides are already in his slides. We don't know, that is what it happened. So I'm not going to talk anything new. I was asked to talk about the future of healthcare, which is actually a 1 year, 2 years course, and I was given 15 minutes for that. And the moment I entered here, and again, 15 minutes I prepared myself, and madam whispered, "Doctor, please make it 7 minutes and we'll go to bang on some questions on you." So I'll rush. So it's going to be an Instagram reel with 18 slides. Yeah. So the most important thing, quality, safety and innovation. So the future of healthcare, what is not future of healthcare? Everything is healthcare now, and I think at this point the world is ready to spend on the health, which they didn't do for last decade. So I was been in the healthcare sector right from MBBS, maybe from 2002, but I see a significant change what is happening in last 4 or 5 years. Maybe COVID has pinched them, then they realized everyone, it's not the rest of the things in this world. Time and health, these are the two important things one have to think about, and good that where everyone thinks about time and health and we are in that sector, so be happy and now it is up to you how are you going to present yourself and how are you going to grab the opportunity. So simply speaking, these are all definitions you can see everywhere. I'm not going to talk about these definitions. Quality of care is the degree to which health services for individuals and populations increase the likelihood of desired health outcomes. See, look at every slide, look at every word. So you can find an opportunity in that every word. So if you grab on that opportunity, maybe you'll be on that podium, and maybe if you're very serious, you'll be in some other place. This is what I expect every person in the healthcare sector to look at. So look out of the box, think differently. So we have 1.4 billion population in India looking for us. So isn't it a good opportunity for us to make it the best? 6 domains of healthcare. This is more of quality in the hospital, yeah. Safety, effective, patient-centered, timely, efficient, and equitable. So I'm not going to rush into all the words. So hope every one of us know what is this. The measures of quality, again, this is also. I want every one of you to correct yourself, your team, and as an organization, review, revise, repeat, and reinvent. So this is how we correct ourselves and make better out of ourselves. And coming to safety measures, of course, again, safety and the health management system we need to establish, build a rapid response system. Of course, this has been now looking at the healthcare sector. A decade back or 15 years back when we were in MBBS, the picture is entirely different. It is only patient, doctor, and a nurse. Now there are n number of opportunities because we have become more into looking every minute details. So every minute detailings in the healthcare sector, right from the entry level, the patient entrance to the exit. So everything has an opportunity in how we take care. So make sure the employees know and understand the safety policy. This is other important thing. So we have a lot of committees and organizations. Did we percolate the substance? Did we just make sure that the least in the algorithm, are they aware of the policies? This is something which everyone have to look at. The healthcare is going to change a big time in the next decade. And if you are in the forefront, yes, you had the best opportunity. And if you are not in that, you are lost in the race. This is every one of us have to be aware of every day. As Mr. Samir already spoke, the people are always looking at the changing trends, and they are always insecure about the profession because, yeah, artificial intelligence is going to be dangerous. And other couple of slides I'm going to talk about that. So next, develop a safety compliance plan. Practice patient-centered care, of course. Every hospital, every organization, and everyone in healthcare sector is always about patient-centric. But in the future, it's not just the patient-centric, it's about the employee-centric. This is very important, which is going to happen. Now people are going to demand about what for me. I'm going to work, I'm going to take care of your patient, I'm going to take care of your organization, but what for me? So this is the next future healthcare where you're going to see. So communicate safety information to the patients and incorporate safe hospital designs. Of course, this is already in vogue. Yeah, leapfrog. This is just a slide which I added. Hospitals are graded based upon this leapfrog hospital safety grade A, B, C, D, F. How safe is the patient in your hospital? Based on that, your gradings come on. Coming to innovation, yeah, this is something which is dangerous at the same time. As I told, if you're on the forefront, you have everything to capture in this. And to first talk about artificial intelligence, yes, there's nothing wrong. Artificial intelligence is going to wipe out lot of job opportunities. But one thing, nursing is the safest at this point because your experience and your knowledge can be replaced, but your skill is not going to replace. Nursing is one profession where your skill set is adequate, which is required, and no robot is going to change that. So artificial intelligence, as hope you have gone through a couple of videos or a couple of news which has come, Elon Musk has quoted, artificial intelligence is worse than what we imagine. So if mankind is in its way and it has something to do, that's not a surprised that it can wipe out mankind. That is the level of artificial intelligence. We only talk about artificial intelligence. There's something beyond that. It's called machine learning. So we are continuously feeding the human intelligence is continuously feeding non-human intelligence, and non-human intelligence is going to take away the world. So if that starts thinking about and that starts taking the decisions, it's called machine learning, and when it start dictating, it is called deep learning. So artificial intelligence, machine learning and deep learning are running parallelly. You like it, you don't like it, all of us are part of this. Your mobiles is part of this, your systems is part of this, your banking accounts is part of this. Already we are living a half computer life. So we are cyborgs. Tell me how many of you are not facing any of the screens every day. So we don't know what artificial intelligence is going to make up in a couple of years or maybe decade. But at the same time, people should understand, don't forget your skill set. We are becoming too fancy in articulating. We are too fancy in projecting and packaging. But the packages cannot be too much than the content. So make sure that you should carry the content. This is what I emphasize everyone. You can advertise wonderfully because of the social media. You can advertise fantastically because of the print media. But if you don't have the content inside, maybe your advertisement may not last long. So I recommend, or I advise, I warn every one of us, we have to concentrate on the manual physical skill set. And this is another important slide. So, okay, I'm gonna rush. So, everyone have to understand, healthcare sector is no more than one size fits all. So as long as you are catering to the needs, just like my slides I made for 15 minutes presentation, now I have to cater it for 8 minutes. And this is another important thing. A recent thing which has come for WHO in September 2022, artificial intelligence, though it is very important, still it is not going to dictate the healthcare sector according to 129 studies and a peer-reviewed paper which has come in University of Spain. So precision medicine, this is going to be the future. So either it is personalized medicine or precision medicine. So the future innovations, of course, again, this most of you people know, or you should be aware of, you should be knowing. The other two important things, red marked, I would like to concentrate. Employer-sponsored healthcare. Yeah, hospitals or healthcare organizations are going to be like this. Now the whoever personnel that are working in hospitals, they might demand for that. Yeah, I'm going to take care of your patient, I'm going to take care of your organization. Are you going to take care of myself, my family and my parents? So you are at demand and it's going to increase and it's going to happen. So behavioral and mental health problems of employees. These are few things I recommend. Need not be, it's not just hospitals, it's not just doctors. I think nursing people, there is a lot of demand everywhere. You should start marketing yourself, you should start promoting. The whole purpose of this conference is that I appreciate the organizing people, organizing team for that which they are doing for the past 9 years. Digital presence, online consultations, integrated approach. Accept that it's not that only I can do, it is lot of us along with us can do. So when you start accepting this fact, maybe we can deliver a better integrated approach and the outcomes might be much better. So I'll rush. Demand for manually skilled personnel is increasing day by day. So it is going to be our future. Come on, you are going to rock it. Potential domains are this. Again, geriatrics and women healthcare is again rocking. So all the days are much more for the healthcare sector. It's all about how are you going to market and grab the opportunity. Change is inevitable. Adaptability is the key of success. With this, I'm concluding.
Thank you,
Thank you.
Dr. Jagdish. What he meant was, he has given us a picture where all the areas that we need to cooperatively learn for the future if we want to be a future prepared nurse and the nurse leaders. Thank you, Dr. Jagdish, for that presentation, and you somehow managed. The next speaker is Colonel Rajgopal. Colonel Rajgopal is one of the senior most professional who has come from army background, and he has got several years of experience in HR management. And he has been conducting several programs on leadership across many hospitals. And I have an experience of attending few of these sessions, and he has conducted last year for our group of nursing leaders a leadership program and visioning program, which was a really mind-blowing exercise. And he had turned out our complete thought process into what a leader should be in healthcare. So over to you, with not taking much time. I think your time is going to be for 5 to 7 minutes, and then we will proceed with discussion.
Good evening, ladies and gentlemen. I'm a bit of a Fauji, so I'm going to say that again. Jai Hind. Thank you so much. Thank you. And the good news is I'm the last speaker of the day, I think. And I'm going to avoid that ambulance siren, right? So I'm going to keep it for 3 to 5 minutes. I'm going to start my session by by something that the moderator in the last session said something. It reminded me, many years back I went up to my chairman and asked him, I picked up the courage of asking him what keeps you awake at night. He didn't tell me that it was business concern or patient quality or safety of patients. He thought about it for a while and said that, why is it that I'm not able to convince my employees that they need to read and they need to pick up knowledge? Why is it that the youth of today don't believe that they can actually go up in life without investing in themselves? And when the last moderator said that the speakers seem to be all very well read, it really delighted me. So good evening once again. I am glad to be among friends. I see Shubhada sitting here, and Jyoti of course is there, and Lekha and Harita. All of them have taught me. I am from a non-clinical background, and frankly speaking, I have learned a lot of healthcare from all these wonderful ladies. So good to be back among friends, and thanks for inviting me and being part of this August panel on the stage. It's an extremely important topic, and the importance of this I've just come to know a couple of years back. You see, as an organization, we were once tasked, when COVID hit us, the Tata Trust approached us to create a course on the COVID management, and they wanted to train close to 8,000 doctors, nurses and technicians on management of COVID through online learning. And that time, the COVID protocols were not clear, nursing protocols were not clear, CDC guidelines were there, were constantly changing. And that time I realized the necessity of involving the trainer, the service provider and the service seeker in sorting out healthcare problems. The other incident that comes to my mind is about 3 years back, the Kerala government called us. You must have heard of Shailaja Teacher. She was the health minister. And she wanted us to set up a simulation center in the heart of Trivandrum for emergency and trauma care. Apparently Kerala faces a lot of emergency and trauma cases, and she wanted all doctors, nurses and technicians in healthcare, in the public health sphere to be trained. And I realized that you need to really involve the doctors, nurses and technicians in co-creation of the training syllabus. Without that, you're going to tremendously fail, and that's my point of today. Co-creation, of course, means involving the professional, the provider and the seeker in any healthcare problem, right? All of you are well aware that some of healthcare is transiting from tertiary health to community health. If that's be the case, then why aren't we involving the community more in their own service? I'm going to talk about it in 2 tracks really. One is about service and one is about education. The point about service that comes to my mind is actually diabetic care. There's research which says that on an average, a diabetic spends only about 5 hours in a year meeting a doctor or looking at prescriptions. Rest close to 100 hours in a year, he's actually self-medicating and caring for himself. So isn't there a case of actually involving the patient in the care of his services? The other point that comes to my mind is actually infectious diseases are giving way to chronic diseases. All the other speakers have spoken about this. If that be so, aspect of lifestyle, diet, smoking should really involve the care seeker when you decide what care to be given. So these are the 2 tracks I'm going to talk about. The first one is about the fact that if you want to co-create and realize that you have a culture to foster collaboration. You can actually do it. I constantly ask organizations, how do you foster collaboration within an organization? And you can actually have systems where inter-departments can actually get along well together to make this collaboration happen. Except students as course developers. You know, today the faculty seems to be at a higher pedestal than the student. Many years ago, I was called upon to do this training of trainer course. And I read a lot of textbooks and précis how to do a TOT, right? And as the date of the TOT started coming closer, I was getting more and more nervous because most of the faculty which I was supposed to train were more senior to me. Till I went up to one of the most senior-most faculties and asked him, what makes a good trainer? Can you tell me in one sentence what makes a good trainer? All of us have learned that there's no ego in learning, but what he told me surprised me. He said the best trainer is one who walks into the class with the humility that he will learn more than impart. You know, the point is that we need to shed these hierarchies if we have to collaborate. The trainer and the trainee have to co-create a training syllabus. Right. I'm going to talk about service delivery. Hospitals are not the only place who create solutions for healthcare problems. Historically, healthcare has been slow in adopting co-creation. We always treat the patient as a passive recipient of service. They're not involved in service ideation. They're not involved in shared decisions. And today the patient is constantly telling you, nothing about me without me. So please involve me if you're treating me. The understanding that service requires varied contributors is necessary in healthcare. Nike, this is not a new concept. Nike is a company which has got customer forums. They have customer forums constantly advising them about what sort of customer service needs to be done. The other example that comes to my mind is that a patient certainly has a biological need, but there's also an emotional and a social need. And this requires long-term care and cannot be only provided by a hospital. It requires the community, it requires other care providers. Right, this particular example is a famous success story about how communities can be involved in anti-smoking and cancer care. Similarly in HIV/AIDS, we have done this before where we involve the community in their own care. So there are lots of examples in the public health system in India itself where, you know, services are provided with community being involved. This is another one of lifestyle diseases, right? Okay, if you want to co-create service delivery, a couple of things that you need to do is actually eliminate a hierarchy and so on and so forth and move from a passive to an active stage. It opens up thinking, it opens up involving the service seeker in his own care. There are processes around this, I won't go through that. But there's a famous book by Eric Topol which says the patient will see you now. The fact that you have to involve patients in their own care was postulated by Eric Topol almost 15 years back. It's a wonderful book, I think you should all read. The other one about service education. We can no longer teach the way we were taught. We can no longer teach the way we were taught. Today, learning styles, adult education, adult principles are all changing. The challenge of moving learning to practice is always there. The challenge of moving classroom to the wide world is always there. But how do I create that transfer climate? The climate to transfer learning from a classroom to the workspace, I can only do it through co-creation. I can only do it if I involve the participant and the student in creating their own service design. Some of us, elementally call it training needs assessment, but this is much beyond all of that. You really need to involve the participant in co-creating his own service design. The advantages again are a lot of the deeper learning, a better training design, and deconstructs paradigm. The moment you keep the participant at a lower pedestal than a trainer, then there's a problem in communication. That's what I like to say as my opening remarks. Thank you.
Thank you, Dr. Rajgopal. So that was a different thought process that was instilled in us. Now we are all going to be a very humble learner from all of you participants. So next 10 minutes we are giving you an opportunity to bring out something that you think that can happen in your organization, in your department, in your wards, that you could co-create with cooperation and collaboration and make a small difference in nursing competencies, in nursing processes and clinical collaboration in your own departments. So think about something like that. And learning from industry partners have not been a new concept. It has been ever since Florence Nightingale's time. And we have been doing, our leaders have been doing that. And we have been doing that in and out. But that will not be a solution for way forward. We have to think differently. So do our nursing care plans from the administrative point of view, the budget plan, the plan for the goals for the year. Do we have something called as co-creation? Do we co-create with our quality department? Do we co-create with our engineering department? Do we co-create something with our medical fraternity? So if we have something like that, that would help us move forward and we will not be lost. So this is what is a message that was given here by 3 of the experts who have just presented their thought process to us. So may I have you come forward? I think it's a very tough task of keeping you awake. I think this is the last session. I request the organizers to pass on the mics. So can we hear from you? If you have any interesting idea that you have already co-created, you could also share that. Or if you have any new thought that is coming now as you were listening to the presentation, you could also share that.
Thank you for the opportunity here. And I'm Captain Sandhya Shankar, and take this opportunity and lead in this session. So I have one question for the esteemed panelists and the presenters here, and I'm also glad to share one innovative thought and a co-created initiative in our organization, which probably will start bringing results. It is starting to show results now. The needle has moved. So first, I'll talk about the initiative in correlation and with cooperation of quality department and learning and development in human resource. Communication is one of the biggest areas and the most important areas where nurses do practice the technical skills, but how to deliver the technical skills with the associated soft skills which they need to hold while touching the patients in a professional manner. Now, these things, and in the hospitals, the learning and development department and the nursing educators and the quality, everybody actually takes their separate sessions, the silos, which we spoke in the morning. Now, how to marry all 3 of them and bring all of them and make patient-centric initiatives and in form of care. So we developed, certain modules, starting from identifying 4 main processes in the hospital, in the patient care, the patient's journey, which directly and indirectly impacts almost 19 sub-processes. And these 4 major processes are IV cannulation, initial assessment of new admissions, then fall prevention, education to patient and family, and the 4th one is medication administration and documentation. Now, while picking up these 4 processes, what is to be done technically and allowing what is to be done and what is to be said, how it is to be delivered and sent to the patient. In the form of, learning module which the nurse can carry it in her pocket, use it as a ready reckoner, having a third party. First is building the content with all 3 of them, putting not the HODs or the senior people, the frontliners, the nurse educators, the quality nurses, the L&D manager and the L&D executive who battles day in and day out with nurses. Nurses pose a lot of challenge on them. So everybody spend time in building the content, then the module literature and the innovative carry, takeaway package for every staff nurse. So it has started to move because we saw significant difference in, while we just narrowed our focus in this, because when you talk of a long list of procedures, it doesn't work. But something more impactful, which would have an extended impact and a lasting impact on patients and families, started there. We'll be more than happy to share this learning.
Thank you, Captain Sandhya. Give a round of applause for the good example, which is very clear and understandable for all the participants here. I think even the young nurses, the students would have understood this is how we start the co-creation. So, do you have any other ideas from any of you? Thank you, Captain Sandhya. Or if you have questions, probably you can throw in some questions.
That's why I have one question. Can I ask?
Shivangi Jadhav, and I would like to mention that I'm very proud to be associated with ANEICON. My question is to Dr. Sameer. In your presentation in the beginning, you mentioned like in 2021 that heart disease was the topmost. Like being health of the all human beings is in our hand. So we talk lot about like morning also sir said that Hyderabad is hub for medicine, pharmacology, IT and also what I wanted to like we very less we speak about the preventive aspects like because we are treating the patients. Why in view of future of healthcare, why don't we more focus on preventive aspects? Like we know that on the roads, lot of people those are selling the diseases. So that is why the ISD you said it is not opposed. So how we can contribute as a healthcare professionals?
I think it's a great question. So it's who owns your health? That's really the question it comes down to, right? Most people have given that keys to who owns their health, to a doctor or Dr. Google or fate, right? Because when an event happens, that's the only time you really remember hospital doctor. So let's use an analogy from quality. In quality, NABH has done remarkable things. Who thinks NABH has helped them? Raise their hands. It looks like about 30% of the room. Really, only 30% believe NABH has helped them. The rest think it's hurt them. Who thinks NABH has hurt the institute they spend time in? Only one, Dr. Sandhya. It has hurt you.
No.
Help. So now I'm asking hurt. Anyone thinks it's hurt? So the reality is, how many hospitals in India have taken NABH? Because it's like a no-brainer. It helps, right? We all agree.
Yes.
It's less than 10%. Now, if you ask the other question, let's go downstream and ask the customer. How many customers every day choose a hospital because it's got NABH? Less than 1%. In India, less than 1%. So the reality is we have to bloody educate our own people downstream to take ownership of their own damn health. Right? So I think step one is if you take ownership, and everyone takes ownership when there's a sentinel event. How did the auto industry do this? It had an annual checkup every year for the car. And if you didn't do that checkup, you couldn't get your road license. One. Number two, insurance premiums went up. Right? Also, you learned that if you didn't do your checkup and you got stranded somewhere, it's your own bloody damn fault. How many people say it's your own bloody damn fault when they come to the hospital? Do any of you do it? No. I told my mom last year. Right? My mom was in the hospital. I told her it's your own bloody damn fault. You had a chance to go and do the test a year ago. You bloody wasted all this time. I mean, then we treated her with empathy and I was nice in spending time with her, but it was a lot of damn hard work making sure she took ownership of her health. So I think the tools that are available they're already here. It's like NABH has been here for a while. Why are hospitals not doing it? Why are customers not doing it? Because we haven't educated them enough. Why are people not taking ownership of their own health? I think COVID was a remarkable moment in time that gave that trigger. Unfortunately, we as humans did not pay enough attention. You look at how many people wear masks, right? Today, it's like a seat belt in the back seat of a car. I see people holding the helmet in their hand like it's a prize trophy. When you put it on your head, man, your head will be safe. Your hand is not going to be any safer by holding this. In fact, you might hurt somebody when it flies. Right? It's stupid common sense. And I think the irony is, sense is not very common. I think if we take ownership for what's in front of us, and if we each do something different today, I will wear a mask on a plane no matter who the hell sits next to me. Right? Priyanka Chopra, Narendra Modi. I'm still wearing a damn mask. I might take it off for a few seconds for a photo shoot, but mask is bloody going straight back on. I think the same way as I take it off for my food. So I think it's the simple little things. Take ownership of your life. That has got a higher probability. It will take longer for customers to pick it. Right? But here's the good news. How long will it take Dr. Google to pick out the doctor as the most trusted advisor for health? Less than 10 minutes.
Thank you. That was a very insightful question. So she asked a question: should we follow a medical model or a nursing model? Many of our nursing protocol or policies, we don't have a nursing model incorporated. So nursing model incorporated is like preventive mode. We are not to give more disease to patients who are coming to us, but to reduce and see that they are better off and they don't come back to us. That is what is a nursing model of care. And very good question. Thank you for asking that question. And thanks, Sam, for stepping out.
Can I just share
Yes.
something?
Sure, please.
Congratulations to the panel here. I have something to share on co-creation. I think in the earlier panel it was mentioned that instead of HMIs we need to have nursing management system. So it relates to this. One of my techie friend when I was in global hospitals had told me that whenever we are designing something in the hospital which is going to help you save time, of course the HMIs. So when we asked him that what do you have, so he said that you ask and you shall receive, because we may offer you 5, out of that 1 you may use, 4 may be useless for you. So I think in nursing, if you really want to have best management systems which will ease the frontline nurses, we need to have more pilots for pilots. I keep telling my nurses also, because now we are in process of changing our HMIs, and the way our hospital is taking up is the nurses, we have HMIs champions who are on the board, and unless the nurses are convinced, we are not going to take any HMIs. However, successful they may be in other hospitals. That is what is co-creation for us, and I think we are implementing that in our hospital before we go for a new HMI.
Thank you, Prajakta. Please round of applause for her. So what it means here is design thinking.
You should add something. The next time the CTO or CIO goes for the review of an existing hospital where that system is, ask for the nurse to go, right? Because I think you should go and you should check it. And most people don't do this. It's a
We
simple
already
check.
have a champion group. Our CEO and our management has said unless there is a yes for nursing, we will not go ahead with any HMIs. So all the high-level meetings are attended by my champions. There are 6 champions.
There are many hospitals probably will not have such opportunities, but leaders stand up. Leaders stand up, say that you are able to be part of any committees that is happening for patient care and get involved, including designing of hospital, designing of the ward, taking an equipment into your unit, or probably suggesting something that is going to come as a resource into your department.
It's like
So
your
what-
antibiotics, no? We have our bugs in our own, in a hospital that we have to know. Our HICC has to know. Similar way, HMIs or any management system, the nurses are using it maximum in the hospital. And they should be the decision makers, and it's a co-creation according to me.
Great. So we are going back to the first session of the day. So never work in silos. So we started off with the thought, never work in silos, and we are coming back to the end saying that it is important for us not to stay in silos, but to spread our wings, extend and expand, and it is very important for us. And what comes out here is a design thinking. Think out of box. I think we should propose this to Annie. Probably in the upcoming Annie in 2024 ANEICON, we should also call for papers who have brought in new products, new processes, probably a design thinking that they have innovated or applied, or it could be even a startup, doesn't matter, in their own organization. Probably I request Annie officials to look into this request and also allocate a fund so that next year we would have more design thinkers, more co-creation and more collaborative activity which would actually support nursing. If nurses are not going to learn finance, if nurses are not going to understand biomedical aspects, if they are not going to understand what is happening in the boardroom, then we are not going to go forward. We are going to be stuck. So it is not the few leaders that you see in the front, but we want every one of us at the back to be also like the leaders, those who are seated here. I salute all the leaders, those who are leading as of now India's healthcare, but we don't want others to step back and to watch. We want you to be in the middle of us so that you tell us and we learn from you. Wish you all the best and have a good evening and enjoy the day. Thank you. Thank you, Sam.
Thank you, dignitaries, for enlightening our thoughts on cooperative learning. It
And
was
one more
great.
request. One more request. if IIT or any other organization, if are ready to come forward to evaluate and even sponsor us or fund us, we are very happy, Sam. I'm leaving that to you.
We'll cover that 1 lakh every year to the top paper from us for the next